In this video, we will be demonstrating how to run the Advancing Care Information Report and how to complete the required measures in the TRAKnet application. To run the Advancing Care Information Report, click on Reports in the top left-hand area of the TRAKnet application, hover over Quality Payment Program, and select Advancing Care Information. On the Advancing Care Information screen, you can select the provider or group, location for the report, and set the attested measures. Next, click the Attested Measures button. On the Attested Measures pop-up, select the year and date range you're reporting for. Select the appropriate radio button for each measure and click Save. Select the appropriate date range and click Execute to execute the report. Please note, the attested measures only apply to the Advancing Care Information Report and will not be considered if running the Advancing Care Information Transition Report. Now, let's review each measure and how to complete them. Measure 1 of the Advancing Care Information is electronic prescribing. This is the percentage of permissible medications sent electronically. To perform this measure, you will need to search for the patient you will be writing a prescription for. On the patient's chart, click the RX button. The pop-up will show you previous medications prescribed in the TRAKnet application. Click Prescribe in the upper right-hand corner to start writing the prescription. This will bring you to the Medications and Allergies screen. Click Next in the top left of the screen to proceed to the Select Medication screen. On the Select Medication screen, there are two tabs, Favorites and Medications. You can choose a medication from your favorites or search for a medication in the medications database. After selecting the medication, click the Next button. At this time, any medication or allergy interactions will pop up alerting the user. If you receive a pop-up, you have the option to click OK and proceed, or go back and select a different medication. On the next screen, the prescription writer, you will need to enter the prescription details. The top section is required, and all information but the dispense and sig will be pre-populated for you. The e-prescribing section is required for sending prescriptions electronically. Click the small box with the three dots in the right of the text field to search for and select a pharmacy. The next section is optional information that can be added to the prescription when sent. Once you have filled in all desired information, click Next to be taken to the confirmation screen. On the confirmation screen, you can review the prescription information and send or print the prescription. Measure 2 is Provide Patient Access. This measure requires that the eligible provider provides the patient timely electronic access to their health information. To complete this measure, the patient must have an encounter within the last 4 days. Search for and open the patient's chart and click the Patient Engagement button in the bottom right-hand corner of the patient's chart or the CCDA button in the top of the patient's chart. On the Patient Engagement screen, you can choose the Encounter Note, Summary Template, and make any changes necessary. Once you have the correct Encounter Note and Summary Template and have made any desired changes, click the Actions button and select Send to Portal. Note, when sending a CCDA using the CCDA button, the default template will be used in conjunction with the last encounter made. There is not an option to change this. Measure 3 is the Request or Accept Summary of Care measure. For this measure, the eligible provider must request and receive an electronic summary of care document and import that document into TRAKnet. To complete this, save the electronic summary of care document to the local computer, click on Tools in the upper left-hand area of TRAKnet, and select Clinical Summary. On the Clinical Summary screen, click Import, select the location where the file is saved, and then select the file and click Open. Select the file from the list and click Associate to associate that file with an existing patient. Measure 4 is a security risk analysis measure. This measure is completed outside of the TRAKnet application. We recommend using HIPAA Secure Now or TLD systems to complete this measure. For more information, please see our TRAKnet wiki page through the link in the description of this video or call our customer support hotline at 855-944-2995. Measure 5 is Send a Summary of Care, Transition of Care. For this measure, the eligible provider who transitions their patient to another setting of care should electronically send a summary of care record for each transition of care or referral. To complete this measure, search for and open the patient chart for the patient which will be transitioned to another setting of care. Click the referrals in the lower right-hand area of the patient's chart. On this screen, you can select the visit for the referral summary and create a referral letter. Once you have created the referral letter, you can either fax a referral or send the referral through direct mail. To send the referral through fax with the Interfax integration, click the fax button. To send the referral through direct mail, click the Actions drop-down and click Send Electronically. Please note you must have direct email for the provider you will be sending the referral summary to in order to send through direct email. Once a referral has been sent electronically, the user needs to record that this has been completed. To record completion, click the Referral Management tab and click the Add button. Enter the referring provider, change referral summary provided and referral summary provided electronically to true, and click Save. Measure 6, Clinical Information Reconciliation, requires the eligible provider who receives a patient from another setting of care or provider of care or believes an encounter is relevant should perform a medication reconciliation. To complete this, you will search for and open the patient chart for the information to be reconciled. On the patient chart, click the CCDA button and select Import CCDA. On the incoming clinical summary screen, you will see a list of imported CCA documents for this patient. Please note, if you do not see any documents on this screen, please follow the steps for Measure 3, Request or Accept Summary of Care to import the CCDA document. Select the CCDA file to be reconciled and click Reconcile. On the pop-up screen, you will see 3 boxes on the left and 3 boxes on the right. The boxes on the left are the incoming items to be reconciled. Select the items you would like to reconcile and click the arrow in the middle to move the items from the left to the right. Once all items to be reconciled have been selected, click the desired Reconcile button. Note the measure requires that all sections be reconciled. Items can be reconciled by section or all at once, but keep in mind that the Reconcile window will close after a Reconcile button has been completed. Once you have clicked the desired Reconcile button, a pop-up will appear to detail the items to be reconciled. Here, you may click Reconcile to complete the process or Cancel to cancel the process. Measure 7, Immunization Registry Reporting, requires that the eligible provider is in active engagement with the public health agency to submit immunization data and receive immunization forecasts and histories from the Public Health Immunization Registry or Immunization Information System. To attest to completion of this measure, click the Attested Measures button, select the reporting period, and the radio button for immunization history. Measure 8, Patient-Generated Health Data, requires that the patient-generated health data or data from a non-clinical setting is incorporated into the Certified Electronic Health Record technology for more than 5% of all unique patients seen by the eligible provider during the electronic health record reporting period. To complete this measure, search for and open the patient chart for the desired patient, click on the Multimedia tab, and click the Add Document button. This will prompt you to import or scan a document into the patient's multimedia. Select whether or not this will be an uploaded file or a scanned document. Under Document Properties, select the type Patient Generated Document, set the date if different date is necessary, and add a title for the document. Once all information has been set, click Import Document to import the document to the patient's multimedia. Measure 9, patient-specific education, requires that clinically relevant information from the certified electronic health record technology be used to identify patient-specific education resources and provide those resources to the patient. This measure is completed along with the Provide Patient Access measure. Patient education links according to the patient's medical information are added to the patient summaries when they are sent to the patient portal. This can also be completed separately by clicking Patient Engagement in the lower right-hand corner of the TRAKnet application. Click the Patient Education tab in the top left. Select the user-created education template to send. Click Actions and click Send to Portal. Measure 10, Secure Messaging, requires the eligible provider to use electronic messaging to communicate with patients on relevant health information. To complete this measure, the patient will need to access their patient portal site and send a message to the provider through their patient portal. For Measure 11, at least one unique patient seen by the MIPS eligible clinician must view, download, or transmit their CCDA. To complete this measure, the patient must go to their patient portal and view, download, or transmit the CCDA sent to them by the practice. The last measure is the bonus score measure, Public Health Registry Reporting. For this measure, the eligible provider is in active engagement with the public health agency to submit data to specific health registries. To submit to public health registries, click on Reports in the upper left-hand side of TRAKnet, hover over Specialized Registries, and select Healthcare Surveys from the list. On the Healthcare Survey screen, search for the desired encounters, select the encounters to be exported, and click the Export button. This will prompt you to select a location to save the file. Once the file has been saved, return to the Advancing Care Information Report, click Attested Measures, and toggle the Healthcare Survey to Yes. This concludes our video tutorial on the Advancing Care Information Report. Please refer to the description of this video for a link to the written guide that outlines these steps, and thank you for watching.